Okay, so could we maybe describe what the Affordable Care Act is and what it's changing from the current system?
Okay, now the Affordable Care Act is a good step in the right direction because it sets up a procedure that about half the uninsured will be able to get health insurance. Many of them will be allowed into Medicaid, at least in the 26 states that have agreed to do this. So more poor people and more working people, low income working people, will be able to get health insurance through the government, through the safety net program of Medicaid. That's a good thing. Second, it gives subsidies, actually very large subsidies, for people to buy health insurance on their own. That happens through what's called the state exchanges. And you get subsidies to help you buy health insurance up to an income that could 4 times the poverty level, or for a family of 4, up to $80,000. People will still be eligible for subsidies. Most of the subsidies, of course, will be going to lower income people, those who have too much money for Medicaid, but are still burdened by the cost of health care. Third, the Affordable Care Act bans many of the things that insurance companies have been doing to increase their profits by denying health care to people who need it, people with what's called pre-existing conditions. For example, if you go to a health insurer and they look at you and see that you're overweight, they would deny you coverage before the Affordable Care Act. They would deny you coverage if you had high blood pressure, if you had ever had cancer, if you had a history of depression, if you were a smoker. They might give you health insurance, but only at higher prices. Being a woman was a pre-existing condition. So women would pay higher insurance rates before the Affordable Care Act. Being older was a pre-existing condition, so they would either deny coverage automatically to anybody over 50, or they would charge rates of 10, 15 times as much. So those were all banned. Insurance companies aren't allowed to do that. They have to offer coverage to anybody. And men and women, same rates. Older people, they can charge a little bit more, up to 3 times as much as younger people. But still, that's a big improvement over the way it used to be. And the Affordable Care Act puts restrictions on what can be in a health plan. You have to be a so-called qualified health plan. Qualified health plans have to meet conditions that they actually provide insurance to people. So the Affordable Care Act will help on all those things. What it doesn't do is, first, it doesn't provide universal coverage. About 20 million Americans will still be without coverage after the Affordable Care Act is fully rolled out. About half of those are people who are undocumented immigrants, and the other half are people who, despite the subsidies, are still unable to afford health insurance because it's too expensive. And the second thing is, the Affordable Care Act doesn't address the cost of care. There's basically nothing in the Affordable Care Act that is going to quote the president, bend the cost curve. And I might add that President Obama is well aware of that, which is why he was a supporter of single payer. And if he had had his druthers, I'm sure he would have pushed a single payer bill. But the sense in the White House was that there's no way they could get a single payer bill enacted through the Senate. So they went for what they could get, which is an improvement on the existing system. Because the Affordable Care Act works with the existing health insurance system, it keeps all these expensive billing and insurance-related activities. The Affordable Care Act does nothing about drug prices. That was a deal cut right at the beginning. The political arrangement, we won't touch drug prices and you won't fight the bill. So the result is costs will continue to rise under the Affordable Care Act at pretty much the way they would have risen without the Affordable Care Act. The result will be health care will become increasingly unaffordable in America.